Good day, my name is Dr. Rapiti, and today, I want to talk to you about a condition that is frequently misunderstood both by doctors and patients. The condition is called asthma, and today I want to talk about the various, what I would call myths and misunderstandings of the condition, and which in effect causes the undertreatment of this condition. So I'm not going to go into great details about asthma, but I'm going to touch on certain aspects that you may not be aware of. Asthma doesn't necessarily mean that you have symptoms if you have a wheeze only. In fact, I would estimate that almost 90% of the people who have asthma rarely ever have a wheeze, and almost close on to the same number of people never end up ever getting treated because they do not hear a wheeze, neither does their doctors hear the wheeze, so they assume that the asthma is either gone or it's recovered and it doesn't exist. And some of the symptoms that are most common to asthma, and wheeze incidentally is not one of them, is a cough that would not go away. A cough that would be triggered, for example, when one is exposed to perfumes, sprays, noxious substances like gas in the winter season, scents, smoke. If any of these can trigger factors or noxious agents trigger off a cough, it's most likely that you have asthma. The other time is when you cough, especially at night. If you're coughing more than 3 to 4 times a month at night, then that is diagnosed as asthma. The other symptom is a shortness of breath that doesn't fit in with the age of the individual. A young person who runs up a small flight of stairs suddenly gets out of breath is not necessarily unfit. If you've had asthma, it's most likely what is happening to you is that your airways are getting narrowed as a result of you breathing in the cold air, and the narrowing of the airways is causing you to get tired. Now, many people go along right up to the age of 60, 70 without knowing that they've got asthma, and it is not mild asthma. I know most pulmonologists refer to it as mild asthma. The danger about labeling this type of asthma as mild is one would think, oh, I'd get by and go away with it, I wouldn't need to treat it. The other big myth I need to clear out of people's mind is that using a pump for asthma does not make you addicted to the pump, nor does it weaken your heart, because the dose in the asthma pump is 1/200th of what the liquid form of a syrup would contain. For example, one puff of asthma pump like Asthma or Ventolin would have 100 micrograms. 1 teaspoon of Ventolin syrup or Venti syrup is 2.5 milligrams. That's about 2,500. It's 25 times more than one puff. In effect, an individual using a puff, only 50% of that goes. It's only 50 micrograms, and that 50 micrograms is sufficient to open up the airways. And the best treatment for this cough is the asthma pump. And here again, we need to stress there are 2 types of pumps that in particular. One is the reliever, that is your Asthma, your Ventis and your Ventolin, or Barotec. The other one is the steroid pumps, and there's a whole range of steroid pumps, and one shouldn't mistake these steroid pumps as the booster steroids. These steroid pumps works on the inflammatory process where there's inflammation. It's the inflammation in the airways of the lungs that causes these coughs. So using a cough syrup is really a waste of time. It doesn't deal with the problem. It puts you off to sleep, but it doesn't stop your coughing. So the ideal thing is to use a good steroid pump, like Budaflam for one would be one, Pulmicort would be another one. Then there's Flixotide. These are all very safe. The doses that one uses, is very safe. Now, a lot of people would say, but I can get by without treating my asthma. I've been doing fine. And I would say, fine, you wouldn't feel greatly discomforted by it, but what you're not aware of, when you have this type of asthma, where you only cough. The only way to really test how bad your asthma or your airway tightening is to do a peak flow. Now, people who have this so-called mild asthma, only a cough, and think their asthma's gone away, might blow only 50% of what they're capable of or potential should be. In other words, if an adult should blow 500 milliliters per second on a peak flow meter, they'd only blow 200, and they wouldn't have a single symptom. They would not feel tired. They'd walk about normally. But the minute these people run or do anything physical, even from adolescent stage, they're extremely tired and they do not. What happens to many of these young children who so-called grow out of asthma, they're told by their doctors that they've grown out of their asthma, is that they never participate in sport. And you know what happens? They become couch potatoes, they become overeaters, they become obese, they become social misfits. The other reason why I'd like to treat the cough at night in particular is that if you have, it's called nighttime dipping. When the temperature drops, the airways are very sensitive to this cold weather, and it triggers off the cough. Now, this cough disturbs the sleep. Many of you experiencers will recall that when you are at school, at work, even though you slept a good 8 to 10 hours, the next morning, round about 10 o'clock in the morning, you feel extremely tired or drowsy. Now, picture this in a school-going child or scholar. This child, for most part of their lives, is feeling very drowsy around about 10 o'clock. They cannot pay attention to what's being taught in class. With the result, they do pretty badly in school because of the lack of concentration. So I do not know how many asthmatics have done extremely bad in their life, in their scholastic career, because asthma is not being treated. My suggestion is that if your peak flow is low, treat your asthma. You will feel much better. I need to mention that many Olympic champions have been asthmatics, and they would have not been champions had they not used the pump. Many of you who frown upon using the pump, my simple answer to you is this: by not treating your asthma adequately, you'll be a bicycle when you could be a motorbike. If you choose to be a bicycle, then so be it. You'll be missing out on sporting activity. You'll be affected in your work, in your studies, and I don't think it's too difficult a choice. I personally, if I had asthma, I would treat it. You cannot gym without treating your asthma if you've got asthma. So there's really no such thing that you outgrow your asthma. I hope this little bit of information will be of use to you. And please don't waste your time buying cough medicines, because lots of people end up cough medicines, getting antibiotics, and the flu preparations are probably the worst things, because what they do is they dry up secretions, they cause more irritation than anything else. So I hope you will take my advice, use the pump, get yourself checked, treat it, and do not be afraid or ashamed that you got asthma. Thank you very much. I hope you enjoyed this video. Dr. Rapiti signing off. Thank you.